Today's discussion is going to be about personal safety measures. Hi, I'm Kathy Getrust, and I'm an instructor in community health. Emergencies are events that call for immediate action. First aid is that immediate care that's given to a person that is in crisis. This crisis may vary from a person who has fainted or a full-blown heart attack. First aid provides that care until additional help arrives. Your responsibility as a caregiver is to stay with the individual, notify the nurse, or call for help of another professional, and begin the first aid. Once professional help arrives, you may be asked to stay and assist in some other way. Be sure that you know in your facility what your responsibilities are in an emergency situation. The first emergency that we're going to be talking about is if someone is choking. Choking is when the throat is blocked and air cannot get into the airway. As you know, we human beings cannot go very long without oxygen in our lungs. In this situation, if a person is choking, you must take quick, decisive action. There are many causes of obstruction of someone's airway, but the most common ones are dentures, which may be ill-fitting and fall to the back of the throat and obstruct the airway. It can be from poorly chewed foods. Frequently, people are talking or laughing when they're eating, and that can lodge in someone's throat. Another common cause of obstruction is meat. Generally, the meat is too large a size to be easily swallowed by an individual. Vomiting is also a very dangerous situation. When someone vomits, the material that is vomited may, instead of coming out through the mouth, may go into the lungs instead. This sucking into the lungs is called aspiration. And obviously, if there is material in the lungs, it makes it difficult for oxygen to be in the lungs at the same time. There are two types of obstruction. The first is partial obstruction. With a partial obstruction, the person can speak and is generally coughing vigorously. Maybe that's happened to you, where you feel like something has gone down the wrong way, and you start coughing, and you know that it is uncontrollable, and your body must continue to cough until the obstruction is relieved. Your responsibility in that instance, if the person is able to speak and is coughing vigorously, is do not intervene. Coughing is the most effective way to dislodge material from the lungs. But do stay with the individual. Do not leave them. Provide them with reassurance that you're going to stay with them. We had an instance several years ago in our area. A woman, in fact it was the mother of the bride, was at a reception, and she had a partial obstruction, and she started to cough, and she was coughing, and all the people were watching her. And if that's ever happened to you, you know that it's really a very embarrassing situation, especially being the mother of the bride. So she got up quickly, went to the bathroom, and no one followed her into the bathroom. She was later found dead. The partial obstruction had gone to a full-blown obstruction where no air was allowed into the lungs, and breathing ceased, and she died. This could have been avoided, I'm sure, had someone stayed with her to be sure that she was continuing to cough effectively and that the material in the lungs was removed and the situation was resolved. Complete obstruction is when the person is unable to speak, and if they're breathing at all, it's only a very high-pitched, squeaky kind of wheeze that you might hear. In addition, with a complete obstruction, the person will do what's called a universal distress signal. With that, there's a grasping of the throat, and their mouth is open in an attempt to breathe. The skin can change to a bluish, grayish, or dusky color as well. Now I'd like you to watch what to do in the event someone is choking. This demonstration is called performing abdominal thrusts, also known as the Heimlich maneuver. Ask the person if they're choking. Determine that it is a complete obstruction. Standing behind, slide the arms under the armpits and wrap both arms around the waist. Clench the fist, keeping the thumb straight. Place the fist thumb side in against the abdomen slightly above the navel and below the rib cage. Grasp the clenched fist with the opposite hand. Deliver rapid inward and upward thrusts until the obstruction is relieved, keeping the elbows bent. If the airway is still obstructed, continue this procedure until successful or the victim becomes unconscious. There are instances when the abdominal thrust is not the best procedure. If someone is in a wheelchair, if someone is extremely heavy in weight, or if someone is in their advanced pregnancy, an alternate form needs to be performed. This is called chest thrusts. Now I'd like you to watch a demonstration of performing chest thrusts. Ask the person if they're choking. Determine that it is a complete obstruction. Wrap the arms under the armpits and around the chest. Place the thumb side of the fist in the middle of the breastbone. Grab the fist with the other hand and perform thrusts until the blockage is cleared or the victim becomes unconscious. The remainder of this videotape will discuss a variety of other kind of emergency situations. Please watch as Linda Hout, a first aid and nursing instructor, leads this discussion.
This video will provide you with first aid information needed to care for medical emergencies and common first aid problems experienced by residents.
Bleeding occurs when a blood vessel has been damaged. If bleeding is severe, it may be life-threatening. Being able to control bleeding is an important skill. Fortunately, most of the time bleeding will stop by itself. Remember to always wear gloves when working with blood and body fluids. To control bleeding, use the cleanest, absorbable item you have. Some items that work well include towels, hankies, disposable diapers, maxi pads, or mini pads. Always use caution to prevent getting any blood or body fluids on yourself. Gloves will help in this protection. Make sure after you remove gloves that you wash your hands. Gloves are made of latex or vinyl, not steel, and they are not puncture resistant. If you do get blood or body fluids on yourself, wash the area thoroughly with soapy water. Clothing or shoes can be cleaned up with a solution of 10 parts cold water and 1 part bleach. This must be discarded daily. Refer to your facility's policy regarding body fluid cleanup and what disinfectant to use. Remember that even small amounts of blood can look scary to you, the resident, and bystanders. Be sure to check for injuries anytime you see bleeding. Types of bleeding include arterial, venous, and capillary.